26-year-old Paul Whitehorn has fallen from a railway embankment.
Come off the top there, yeah?
Ah, the pain's horrendous, please.
Both legs or one leg?
Both legs.
And you're not
On scene, Paul's account of what happened to him plays a vital role.
Listen, was anyone with you when you fell off the wall? Nobody, you were alone, yeah?
Yeah.
Did anyone see him fall? Do you know if you were knocked out?
I don't know, I can't remember.
Well, listen, you made it from the edge of the wall to here. You're quite a way away. You dragged along, did you? What, using your arms?
Yeah.
Dan's quickly able to establish that Paul does not have signs of a head injury and assesses the damage to the rest of his body.
Yeah, he's got a fracture dislocation of that ankle at least. Listen, try to relax for a minute, because if I don't get this needle in, I can't give you any pain relief, all right? Now keep nice and still, a little scratch coming up, okay?
He is in agony. Dan's giving him a drug called ketamine. It will provide him with the potent pain relief he needs.
Hang on, it has only just gone in, hasn't it? Hold it. Now listen, Paul. Paul, can you hear me?
Yeah.
I've given you some painkillers. You might not be feeling that they're making a huge difference, but they are. We're going to roll you over. We need you flat on your back, and you're going over with us now onto a cold stretcher.
But something unexpected happens.
I don't know what's happening to me.
Okay, we're going to sort you out. Just giving you some very strong drugs, all right? Most of it.
I'm dying.
So let's try to do now.
Paul is experiencing an extreme reaction to ketamine.
Ready, brace, and turn.
It's causing him to hallucinate badly. These reactions are extremely rare and are rarely remembered.
And roll down.
I feel like I'm dying. I feel like I'm dead. I'm dead.
No, you're not dead.
I'm dead.
About 1 in 50 patients suffer these adverse reactions.
I'm dead.
Security, I'll get that back on, and then we're going to pull that out.
Dan has to pull Paul's severely dislocated ankles back into position.
Hey, listen. I've got to give your ankle a little bit of a tweak, okay?
If he doesn't act quickly, this could lead to lasting damage or even amputation.
Could you just hold him for a second? Okay, well done. Try and relax. Well done. Good job.
What's happening to me?
We're lifting you up now.
Now?
Yeah, now. Right
We're
now.
in there.
Super. That's fabulous, Paul. You've done brilliantly, mate.
Feel right now, mate, all right? You got an alien. I normally look like that.
Yeah, sorry.
Drugs obviously working off then.
Let's go.
To assemble a trauma team for a patient that we've just been given notification of.
Paul, what exactly is hurting you, yeah?
My legs.
Your legs what? Right, okay, well wiggle your toes now. And wiggle the other toe too. There you are. They're still there.
Gareth will lead the trauma, but he must also ensure that Howard continues to receive minute-by-minute care.
Ken's one of the med regs here, okay? I'm just going to hand over to him for a few minutes while I just do this trauma next door.
What hospital am I in?
You're in the hospital Royal London, okay?
The Royal London is home to the most specialised trauma unit in the country. It may receive up to 4 trauma patients in any shift.
Who's team leader?
Me.
Paul is still suffering the adverse reaction to ketamine.
Where am I? I don't know where I am.
Just give him 2 milligrams of Medaz.
Very happy for handover.
Okay, shut it out.
This is Paul Whitehall. Paul is a 26-year-old gentleman who fell 20 foot off a railway siding, landing on grass. His obvious injuries from top to toe are that he had a fractured dislocation of his right ankle. He also had a fracture of his left ankle. He's had in total 100 milligrams of ketamine, but he has been undergoing a quite marked ketamine reaction, including visual hallucinations.
Thank you. Okay, can we just have 3 people down each side? Paul, if you could stay that side, stay where you are. Just brace his chest there.
It's important to quickly build up a picture of Paul's injuries to see if any are life-threatening.
We're just taking x-rays of his spine now, and to make sure he hasn't damaged that. Because we know from what we call mechanisms of injury that if someone's landed on their feet, if you look at those patients, they have characteristic injuries. They begin at the ankles. You can have certain fractures of the knee, then of the pelvis, and then of your spine. It's all due to the fact that you land on your feet and the shockwave goes up your body. So it means, to go on, just shout. Don't wait for them. People come in with atrocious fractures of their ankles, screaming in pain like this, and actually the fractures of their lower back.
Breathing
fine, circulation fine.
Paul's x-rays confirm Gareth's suspicions about a back injury.
This guy has fractured one of his, I'm not sure if it's a lumbar or thoracic vertebrae on that film, which just shows you he's not complaining of any pain, he hasn't mentioned it to any of the doctors. So we're going to have to scan that now, because it may actually be unstable looking at it, which means it may require surgery, but a scan will tell us a bit more information.
In the CT scan, the team produced precise images of Paul's spine. Although his back is broken, the news is positive. It's a stable fracture which will heal itself naturally, and he will not need an operation.
You bring your head forward.
But getting Paul back on his feet will be a far greater challenge.
It's all very well saving his life, but if he loses his job because he can't walk and he's a postman or whatever he is, then, you know, essentially we haven't done our job.